Brishti Basu, Victoria Buzz.
Hi, Dr. Henry. Thank you for taking my question. I was just wondering if you could clarify some of the outbreak case numbers that you mentioned today. In yesterday's statement, it said that there were 133 cases at Mission Institute, but today you said there's 120. And also at Superior Poultry, yesterday's statement said 52 cases, while you said 50 today. And as well, do you have a number for for how many cases are linked to the Curl Lake project?
Yeah, you know what? I realize that it's a challenge to get the numbers in for some of these early on a Saturday morning. So I gave you the numbers that were on my translated into my sheet from yesterday. So I apologize for that. We'll make sure that the numbers are correct in the statement that comes out later today. That we have many hospitals and many health authorities, and it is actually not as simple as you could think to actually understand who is in which ICU, who is in which hospital, who's positive for COVID. So it is one of the challenges that we have with our just pulling the data together, and it takes a lot of work from each of the health authorities, our epidemiologists who have been working every day on this for a long time. So it is only a matter of timing, and because we start earlier on Saturdays, we don't have those numbers, but we'll make sure that they're in the statement later today when they come in. I do want to report, however, that we've had some challenges with one of our data systems. So I will be reporting right now a data correction in the daily case numbers that affected particularly the Fraser Health region. There was a technical error in the transfer of data from a lab to the health authority, which meant there were errors in reporting new cases between the 17th and the 24th of November.
From Binder Sajan, CTV.
Hi, Dr. Henry. I'm just wondering, a lot of people rely on these numbers on a daily basis, have quite an interest in them, and I'm just wondering how it is that the data was so wrong for Fraser Health for so many days.
Well, this is the travails of our IT systems and the fact that we've increased capacity in our lab by bringing in other labs that have interoperable, supposedly, systems. So a patch was put on one of the systems over the weekend, and the anomaly was only detected yesterday. So it is one of those things. I obviously would not want it to happen. We know that the people who were tested and tested positive were notified, but there was a gap in when those reports came in to the IT system at the health authority. So it is something that happens. We're concerned about one that has been labeled the UK variant, but it is technically known as B117, and we have had 5 cases of the B117 variant detected here in British Columbia.
Binder Sajan, CTV.
Hi, Dr. Henry. Just to clarify, you said that there were 5 cases of the UK variant. The BC CDC in its situation report said 6. And just wondering if you can clarify that and also let us know, are you looking, is there a plan to step up the whole genome sequencing, or is there something that you're looking for the federal government to do here as well?
I'd hate to be... I thought I said I had 5, but if it's 6, then I might be behind one. It could have been that there was an additional case on the weekend that's not in my list, but we can check on that. Since the start of our Immunize BC program, 87,346 people have received a COVID-19 vaccine in BC, and of these, 4,262 people have received a second dose. Can I just, before you go, Marcella, just to note that I made an error in reporting the number of people who were immunized. The minister had it correct. My apologies. It's actually 124,979 people who have received 1 dose and 4,262 people who have received 2 doses. So apologies for that. Since the start of our immunization program, 287,950 doses of COVID-19 vaccine have been administered everywhere in British Columbia. That in itself is an amazing feat. And 58,896 people have received a second dose.
I just wanted to clarify a couple of the vaccine numbers. The number I think that Dr. Henry used was 287,950. That's the number of doses that have come to British Columbia, including approximately 45,000 doses that have just arrived of Pfizer vaccine. The total doses administered is 224,354. 165,458 people have received first doses, and 58,896 have received second doses.